Reversing Type 2 Diabetes, a step-by-step guide. In this video, we're going to guide you through a clear, step-by-step process that can help you safely reverse type 2 diabetes and prediabetes in just 4 weeks. We know that all the terminology related to diabetes can be overwhelming, so we're going to take some time to break things down in a way that's easy to understand. By the end, you'll feel much more confident in the process of lowering your blood sugar and improving your overall health. Let's begin by talking about blood sugar. When doctors say you have high blood sugar, what exactly does that mean? There are many types of sugar in the foods we eat, but the one we focus on in terms of blood sugar is glucose. For example, the sugar you might add to your coffee or tea is called sucrose, which is made up of 2 molecules, glucose and fructose. These molecules are chemically linked together. When you consume sucrose, your body breaks it down into glucose and fructose. The glucose is absorbed into your bloodstream, which raises your blood sugar. However, when doctors talk about high blood sugar, they're specifically referring to elevated glucose levels in the blood. Why is glucose so important? Well, glucose is a form of sugar that the body uses for energy, but if there's too much glucose in the blood, it can cause serious health issues. When your blood sugar rises, your body releases a hormone called insulin to help regulate it. Think of insulin as a messenger. It travels through the bloodstream and signals your cells to absorb the glucose from the blood. In a healthy person, the cells respond to insulin and open up, allowing glucose to enter and lower the blood sugar level. However, over time, if you continue to eat high amounts of glucose, the cells can become overwhelmed. This leads to a condition called insulin resistance. It's as if the cells refuse to open up when insulin knocks, even though there's too much sugar in the blood. When the cells stop responding to insulin, the glucose stays in the blood, which keeps your blood sugar elevated. This is a dangerous cycle, as it means your pancreas has to work harder to produce more insulin to get the glucose into the cells. Eventually, your pancreas becomes exhausted, and it can't produce enough insulin to keep up. This is when your blood sugar starts to rise uncontrollably, leading to type 2 diabetes. Blood sugar levels are typically measured in milligrams per deciliter, mg/dl, or millimoles per liter, mol/L, depending on where you live. To help you track your blood sugar levels, we've provided a downloadable guide in the description. This will give you detailed information about normal ranges for blood sugar, insulin, and other key markers, so you'll know where you stand. Before we get into the step-by-step process to reverse your diabetes, there are 2 important things we need to address. The first is the myth that type 2 diabetes is a progressive, irreversible disease. Many people believe that once you have it, it only gets worse, and you'll need to take medication for the rest of your life. But the truth is, with the right approach, type 2 diabetes can be reversed. If you follow the steps we're about to share, you can take control of your health and reduce your blood sugar. The second myth is that type 2 diabetes is mostly genetic, that it's something you're born with and you can't do much about it. While genetics can play a role, studies comparing identical twins have shown that lifestyle and environment are much more influential in the development of type 2 diabetes than genetics. If one twin lives in a healthy environment and adopts a good lifestyle, they are unlikely to develop diabetes, while the other twin in an unhealthy environment may develop the condition. This shows that your lifestyle choices are far more important than your genetic makeup when it comes to preventing or reversing type 2 diabetes. The first thing we need to address is your diet. As we mentioned earlier, sugar like sucrose, which you may add to your coffee or tea, is broken down into glucose. But it's not just sugar that raises your blood glucose. Foods like rice, pasta, potatoes, yams, and oatmeal also raise blood sugar because they contain starch, which is essentially a string of glucose molecules linked together. When you eat starchy foods, your body breaks them down into individual glucose molecules, which enter your bloodstream and cause a spike in blood sugar. So, what can you do about it? The simplest and most effective strategy is to reduce or eliminate starchy foods from your diet. Instead, focus on eating non-starchy vegetables, particularly leafy greens like spinach, kale, and lettuce. These veggies are low in carbohydrates and won't spike your blood sugar. You should also eat more protein-rich foods such as meat, fish, eggs, and other animal products, which have a minimal impact on blood sugar. In addition, healthy fats like olive oil, coconut oil, avocado, and animal fats, such as lard or palm oil, should be incorporated into your meals. Contrary to what you might have heard, healthy fats do not cause heart disease or raise blood sugar. What you want to avoid are processed oils like soybean, sunflower, and canola oil, as they can negatively affect your health. While you might be wondering if you need sugar to survive, the answer is yes, your body does need glucose, but it can produce all the glucose it needs from fat. Your body can use the fat stored in your liver, pancreas, and throughout your body to produce glucose and energy. This is why you don't need to consume high-carb foods to get the glucose you need for energy. So, step 1 is simple. Focus on eating non-starchy vegetables, lean proteins, and healthy fats while reducing starchy foods and sugars. Once you've adjusted your diet, the next step is to give your pancreas a break. Your pancreas works hard to produce insulin whenever you eat, and when you eat too often, it can become overwhelmed. This is where intermittent fasting comes in. Intermittent fasting involves not eating for at least 12 hours a day. For example, if your last meal is at 7 p.m., you wouldn't eat again until 7 a.m. the next morning. The great thing about this approach is that most of this fasting period happens while you're asleep, so it's easier than you might think. By fasting for 12 hours, you give your pancreas a chance to rest and recover, reducing the strain on your insulin production. Step 2 is practice intermittent fasting by not eating for at least 12 hours every day. The third step is to incorporate movement after meals, particularly after dinner. When you eat, your blood sugar naturally rises, and physical activity can help lower it. Even just a short walk of 10 to 20 minutes can be incredibly effective. Walking after a meal helps your muscles absorb some of the glucose from the bloodstream, lowering your blood sugar levels and improving insulin sensitivity. If walking outside isn't convenient, you can walk indoors or even walk in place. The key is to get your body moving, especially the large muscles in your legs, to help manage blood sugar and keep your insulin levels lower. Step 3 is take a 10 to 20-minute walk after your meals, especially after dinner. The fourth and final step is to prioritize good quality sleep. Just one night of poor sleep can lead to a spike in blood sugar the next day. If poor sleep becomes a habit, it can significantly affect your blood sugar control. To improve your sleep, make sure to avoid caffeine in the afternoon, dim the lights in the evening, and avoid using bright screens, phones, computers, TVs, for at least 2 hours before bedtime. Creating a sleep-friendly environment will help your body recover and regulate blood sugar more effectively. Step 4 is get quality sleep every night by following healthy sleep habits. By following these 4 simple steps, eating the right foods, practicing intermittent fasting, incorporating movement after meals, and prioritizing good sleep, you'll be setting yourself up for success in reversing type 2 diabetes and managing your blood sugar levels. It's not about quick fixes or magic solutions. It's about making consistent, healthy choices that support your body's natural ability to regulate blood sugar. For even more tips and strategies, be sure to check out our next video, where we'll dive deeper into some advanced techniques for lowering blood sugar and improving overall health. Tell us what you think in the comments section. If you enjoyed this video, give it a thumbs up. Subscribe for more health tips.